Hello, I am Dr. Kabilan Saminathan, consultant and head department of urology, Mehta Hospital, Chitpat. So I'm going to talk to you about kidney stones because summer is on and it's time for renal stones. We are seeing more patients with renal stones. I think it is the right time to know more about kidney stones. So I'm just not going to have my own talk. I'm going to brief on the questions which are frequently asked by patients in the OPD. So begin with, they wanted to know how common are the kidney stones. So kidney stones are the most common urology problem which we come across in urology OPD. Every second or third person who's coming to the OPD will be suffering from kidney stones. So it is very common, and kidney stones are the main backbone of urology work. So next question is, what are the various types of stones? So the stones, kidney stones, it's not a separate something which is newly formed in the kidney. Whatever salts which are normally excreted in the kidneys, when the concentration of them is increased, like when you are taking less amount of water or due to some reasons, when their concentration in the urine is going to be above the supersaturation limit, a small crystals will be formed. This is called as crystallization theory. So once these crystals aggregate to form a very small calculi, hardly a 1 millimeter stones, over a period of time, these stones will get bigger and bigger in size by a process called as layering. So all the stones all form in a small part of the kidney called as the renal papilla. The stones will be stuck to the renal papilla. Renal papilla is the apex of the renal pyramids, if you can recollect what we read in schools about the renal anatomy and physiology. So over a period of time, once the stones get bigger in size, at any point of time the stones can get dropped or get detached from the attachment, and they start to move along the urinary tube. Once they are starting to move along the urinary tube, because of blocking the urinary passage, that is called as the ureters, the back pressure changes happen and the kidney swells in size. The ureteric muscle contracts and tries to push the stone outside. So this is the time when we get severe pain because of the kidney stones. Now, what are the various types of stones? Most common stones will be the calcium oxalate stones, followed by uric acid stones and triple phosphate stones. Rarely we might get some drugs which we take for HIV treatment, or drugs which we take for the antacids which we take for acid peptic disease can also cause drug stones in the urinary passage. Yeah, so already I told you. So most of them ask us what is the mechanism. Already I told you the mechanism. Supersaturation theory and crystallization concept and layering effect is the one which causes the stone to form and the stones to get bigger in size. But this is the logical explanation. Our own kidney, the people will be susceptible to different levels. Some people are more susceptible and some are less susceptible. So reason for that is not only the crystallization happens in the kidney does have some natural protective mechanism against the stone prevention. We call them as inhibitors of stone formation. The most common inhibitor in the urine is going to be the citrate in the blood, which filters along with the urine and prevents the stone formation in the kidneys. There are a lot of other unnamed and unknown promoters and inhibitors in the urine, a balance of which determines the stone formation tendency in an individual. But the most important thing is, once a stone is formed in a person, the risk of forming stones is around 50%. So 50% risk of forming the stones again. Yeah. So why are we very much concerned? Why are we very much bothered about kidney stones? One it causes lot of trouble. Severe pain in the flank region, lower abdomen, or in the middle of the abdomen, or in the genitals, or in the thighs. The pain can happen. So this pain is similar to the labor pain in which the women experience during childbirth. So such an intensity of pain really puts you away from work. In addition to that, the kidney stones can cause damage to the kidney. So that is the reason why we are very much worried about the kidney stones. So sometimes it can be very silent or innocuous also. People tend to develop repeated urinary tract infections. So we keep on treating them with antibiotics. The culture is still being positive. Simple test, ultrasonogram, when taken, we can find out that the kidneys are having some stones. The kidney stones are source of infection. The bacteria finds a sanctuary in the kidney stones because the stones are devoid of any blood vessels. So the body immunity cannot reach the stone. So the bacteria finds it as a sanctuary and stays within the stones and repeatedly causes flare-ups and urinary tract infection in the people. So another important cause is blood in the urine. So blood, sometimes, mostly it will be a painful bleeding. Rarely I have come across patients who present with only bleeding without any pain or other symptoms. When we do an ultrasound or a CT scan, we pick up kidney stones, and once we treat the stones, they become alright. So going on to so how does the kidney damage happens in kidney stones? There are two types of stones. One are obstructing stones and other are non-obstructing stones. The obstructing stones, it is always believed that stones which obstruct the passage are the more dangerous one, because once the obstruction to the urinary passage happens, the urinary flow on that side stops, the kidney begins to swell, and we can clearly understand when the pressure builds up in the kidneys undergo damage. The most important thing is these kind of stones usually doesn't cause kidney damage at all, because the patient comes for treatment because of severe pain, and most of the time they get it treated and become alright. More dangerous will be the non-obstructive stones. In 20% of the people, it will be a silent renal stones. The silent renal stones will set up an inflammation within the kidney, which we technically called as interstitial nephritis. So over a period of time, gradually the kidney loses its functioning parenchyma and becomes very small in size. Many people with kidney stones tend to develop bilateral kidney stones. In this scenario, bilateral stone formation, bilateral kidney damage can happen, and many people do land up with renal failure and kidney transplantation. Yeah, already I discussed about the pain and symptom pattern in kidney stones. So what to do? What to do when we have a kidney stone? So when you need to consult, most of the time you land up with the emergency department of the hospital, where they do a scan for you. So most of the time when we advise a CT scan for a patient with pain abdomen, people are very reluctant to accept the CT scan because it is very expensive. So they ask us to do some ultrasound. Why can't we do ultrasound? Because it is very less expensive. Most important thing is, whenever there is an acute pain abdomen, we need to do a CT scan, because it has got some negative predictive value, because we can say that there is stone or the stone is not there. So when the stone is not there, we can search for other causes which are very obvious in a CT scans. For example, a patient may have an dilated or an impending rupture of an aortic aneurysm. The patient might be suffering from appendicitis, or the patient may be suffering from some bowel obstruction, bowel pathology, bowel perforation, acute severe cholecystitis. So these can be really a life-threatening events, and this can be missed out when we do an ultrasound abdomen. So I would request you to please go ahead and do a CT scan as advised by the doctor. So once you meet the urologist, we can always plan the follow-up by doing an ultrasound or an X-ray KAB. So we can come up with strategies to reduce the radiation dose to the public. So CT scan will be the treatment of choice. So investigation of choice. So what to do? So once the patient develops stone, it is always advisable to go for a medical management or surgical options which are discussed or suggested by your urologist. So one thing to remember is whether you are having pain or not, always a follow-up scan is a must. The follow-up scan need not be a CT scan, it can be an ultrasound, because already we know where the stone is, what is the problem. So an ultrasound, a good sonologist will help us in tracking the stones, because we have to keep in mind that the stones will be causing pain or symptomatic as long as they are moving. Suppose a stone is staying in the same place, many times the pain goes away, the severe pain goes away, only a dull, hardly noticeable pain remains with us. This kind of stones can really cause quick damage to the kidneys. So we have to do a follow-up scan and make sure the stone is really gone and it is expelled out. So what are the medical management which we usually go? The two different circumstances are there. One is a kidney stone which is not causing any obstruction. Another is a stone which is blocking the urinary tube. For example, once a stone is blocking the tube, already I mentioned to you that flow of urine on that side of the urinary tube stops up. The urine fills up the kidney and the kidney undergoes swelling, and there is a lot of pressure effect within the kidney. So the kidney starts to undergo irreversible damage once we cross a 3 weeks period. So it is very important that whatever treatment we are giving you, it can be continued only for 3 weeks period or more. Depends upon your individual situation, which will be guided best by the urologist, but we have to keep in mind as a rule that 3 weeks period will be the optimal time limit for the medical management to work. Beyond that, the stone is still there, it is better to undergo some treatment which I will discuss later. Whereas stones which are inside the kidney, which are not obstructing the kidney, the management is going to be totally different. We can do a stone dissolution therapy for months. We can usually follow them for 6 months or 1 year and see whether the medical management, lifestyle changes, dietary changes are really working for the patient, and whether the stones are starting to decrease in size. So after a period of say 6 months to 1 year, the stones are not getting dissolved, it's a right time to treat them depending upon the size of the stone and the effects the stones has caused upon the kidneys. So stone dissolution therapy, we usually give, all of us or most of us are familiar with the dissolution therapy and all, plantain stem juice, taking lot of water intake. Some people do go follow up some the herbs and all, the nerinjamuls or ranagalli leaves and all, they try that. I don't say no to them, let them try the stone dissolution therapy. Suppose they want to try medical management, I prescribe them potassium magnesium citrate solution for a 6 months period and follow up the patient whether the stone is getting dissolved or not. So suppose the medical measures are not working, so what are the options with us? So we need to go for some intervention for the patients based upon the stone size and the location. A common treatment will be endoscopic laser treatment for the stones, in which a very small camera, it may be semi-rigid or it may be a flexible scope, is passed into the urinary tube, and using a flexible scope we can reach into the kidneys and break the stones completely using laser energy. It can be holmium laser or it can be thulium laser. Stones which are bigger in size, so they are presenting us at a later stage. The people come with a bigger size, say 1.5 centimeters or 2 centimeters, where endoscopic treatment is going to be very difficult. For that we need to do some keyhole treatment for the patients. So it can be a mini PCNL or conventional PCNL, in which a small puncture is made in the region of the kidney in the back, and track is made into the kidney by passing a guide wire and dilating the tissues to create a passage into the kidney, and a sheath is put inside the kidney and scope can be passed inside and the stones can be treated. Sometimes we do come across large size stones. Say we call them as tag-on stones. So big stone in the central part of the collecting system of the kidney with lot of branches into the all the collecting systems. So these type of stones are called as tag-on calculus, and we have to treat them in a staged manner. With a combination of therapies may also be required to completely clear the stones. So in Mehta Hospital, we have come across and treated lot of such patients, and we have treated also stones in abnormal locations. For example, a kidney normally present in the flanks behind the body. So many times it might be present in abnormal places like lower part of the abdomen, and it will be covered with vital organs. So in this scenario, we treated some patients with combination of laparoscopy, keyhole surgery and endoscopic treatment, and completely cleared the stones for the patients. So previously the other treatment is ESWL, meaning shock wave treatment for these stones was very popular. Nowadays we use them only for very selected patients who are not surgically fit, who cannot undergo any endoscopic or keyhole treatment. We offer them shock wave treatment for them. So now coming to prevention, how to prevent the kidney stones. So already I mentioned to you that 50% risk, once a person has formed a stone, there is a 50% risk that the person will form the stones again. So the basic first step is we need to get the stone analyzed. So we need to know what kind of stones. So the common stones, we know the measures and we can do them. Sometimes they may form some rare stones like a cystine stone or some other kind of stones which might indicate some inborn errors of metabolism. We have to keep our minds open, and then we have to go for specific treatment straight away. Suppose they are common stones like calcium oxalate or a uric acid stones, we need to follow up some measures. Like water intake will be the basic step which we usually advise them, or most of the urology advise them to take adequate water intake. So a lot of questions happen when we tell them what is adequate water intake. So 4 to 5 liters is the mark I give to the patients, because taking forcibly, that is compulsorily drinking more than 4.5 liters of water can really harm your kidneys also. So people who are working in a very hot environment like a printing press or a laundry garment factory, in the laundering, the temperature will be very high, they sweat a lot, so they need to drink lots of water. So the 4 to 5 liters may not be sufficient for them. They need to take 10 liters of water every day also. So rough guide I give to the patient is the urinary color. So make sure during the summertime urine is not dark yellow, it should be light yellow, or in the winters it must be white. Suppose it is dark yellow, try to drink much water till the urine clears. So there is also a lot of doubt what kind of water to take, whether it is RO water, bore water or metro water. So best if good bore water without any hardness or salt is available, that will be the best source. Otherwise we have to put up with whatever is available to the best of our advantage. So then what steps? So people should avoid taking animal proteins, all kinds of animal proteins like eggs, mutton, chicken, fish. All animal proteins are found to be associated with increased risk of kidney stones formation. So we need to try to restrict the amount of animal proteins we take, and we have to supplement them with more of vegetable based proteins like soy proteins, pea proteins, dal. That will be better options. Regarding the vegetarian food, there has been a lot of myths. So logically explaining the increased supersaturation concept I told you, calcium oxalate in high levels, by logical extension, they are supposed to lead to increased stone formation. So we try to avoid milk, curd, milk based products. Then we stop avoiding seeds stop eating green leafy vegetables because we are all thinking logically. But there are multiple factors involved in the vegetarian diet. Recent studies have found out that whatever load which we are giving them through the vegetables, all the negative aspects of the, say, the seeds or the green leaves will be balanced by the fiber which is present in the vegetable foods. So all vegetable foods can be taken, and they in fact, people will take all kinds of vegetables with increased fiber content. They have less incidence of kidney stone formation. So avoiding certain vegetables and taking other vegetables need not be done. All vegetables can be had, and we can have a mixed healthy diet. Regarding milk intake, I tell them the calcium is a very important entity. Increased calcium intake, our diet doesn't provide us with excess amount of calcium. So what is the problem is taking calcium supplements without doctor's supervision. Taking 2 tablets or 3 tablets a day for years together can really cause some problems to us. So taking 1 or 2 tablets over a short period of time will not really harm us. Taking 2 glasses of water, 1 glass of buttermilk or 1 cup of curd doesn't going to harm us. In fact, very low levels of calcium in the diet also is an important risk factor for forming more kidney stones. Coffee and tea can be had in moderations. So weight we need to watch, because obesity, everybody, there is an app in the internet. So we just have to do the BMI calculator, put our height and weight, and we get a BMI. So above 25, there is a risk of increased stone formation. So we need to try to reduce our body weight also in preventing the kidney stones. Yeah, another important thing is salt intake. So increased intake of the table salt, sodium chloride, is associated with increased risk of stone formation. So better to reduce the salt intake also. So in addition to that, in spite of all our best efforts, so good diet, good water intake, we tend to form stones. It means that it's the right time to evaluate for any inborn errors of metabolism that causes abnormal levels of calcium, abnormal levels of uric acid, or low levels of citrate to be excreted in the urine. So we need to do a serum uric acid. We call them as metabolic evaluation, where the blood will be tested for serum uric acid levels, the urine will be tested for infections, and urine culture must be done to rule out any infections, and 24-hour value of excretion of calcium, uric acid, citrate and oxalate must be estimated in the urine, and if they are abnormal, then we have to manage them by specific interventions. Some people have some anatomical abnormalities in the kidney. For example, any block in the urinary passage, like a stricture or a congenital obstruction, which prevents, like a horseshoe kidney, abnormally placed kidney, where the collecting system will be non-dependent. They will be against the gravity. There will be some stasis of urine in the kidneys. This can lead to increased incidence of kidney stones. So this needs to be corrected for taking care of the stones. I think with this I have covered almost all the questions that have been asked by me. If you have any more doubts, you can always post them online, and I'll be very happy to reply them. Thank you.